Tricuspid and mitral.
Yeah, the AV valves, tricuspid and mitral. And then the dub sound, semilunar valve. So what happens between S1 and S2? Hear it. Systole. What happens between S2 and S1? Diastole. Okay, we have two abnormal heart sounds. First one is S3. So this occurs during diastole, and it's when the ventricular walls vibrate and make an extra sound. This is normal in children and in pregnant women. Then it's called a physiologic heart sound. However, in all other adults, it is considered abnormal and it's called ventricular gallop. S4 is another abnormal heart sound. It is always abnormal. There's no normal conditions. It's because of kind of the same thing. It just happens a little bit later than an S3 would. And it's called an atrial gallop. And it is indicative of hypertension, maybe some stenosis in the valves. It could be hypertensive heart disease, or you could have it post-MI as well. So S4 sound, no matter what, is abnormal. It's indicative of some sort of cardiovascular pathology, and it's called an atrial gallop. Okay, so this is just an example of how the heart sounds might change with different pathologies. So normal is you have the lub and then the dub. What's going to happen if the aorta is stenotic? What does stenotic mean?
Closed off.
Narrowed, and think of it as inflexible. So it won't distend.
Back up into the pulmonary artery or vein?
No, the aorta would back up into what?
Ventricle.
Left ventricle. Eventually we'd get there.
Eventually, yeah.
But first it's just going to back up into the ventricle. Okay, so during systole, we would have a lot of noise, essentially. So while the ventricles are contracting, they're trying to push blood into the aorta. The aorta is not really that ready to receive that blood. It can make a whole bunch of noise.
So is that the squirt back noise?
Well, squirt back is technically a regurgitation. The official term for it. Versus stenosis is, think of it as since the artery is not distending, you have this narrowed pathway, and there's going to be more friction as the blood leaves. And maybe not all of the blood can leave.
Okay.
But it's not necessarily going to backflow. Right. That would be regurgitation. So then, what would be mitral regurgitation? Backflow where? From where to where? Which one? From the left ventricle to the left atrium. So again, you're going to hear it when the ventricles try to contract. If the mitral valve didn't close all the way, as the left ventricle contracts, some blood is going to squirt back into the atrium. Okay, so then you're going to, and then it's not going to be as noisy as aortic stenosis, but there's going to be a little swish back into the left atrium.
Is that caused by like a mitral valve prolapse or something like that?
Yeah, the valve would be incompetent. You can't close all the way. Okay, now aortic regurgitation is going to happen when the aortic valve can't close all the way. So the aortic valve is supposed to be closed during diastole. diastole, when the atria are contracting. But if it doesn't close all the way, you'll have some blood leaking back from the aorta into the left ventricle. Anyone awake beside Andrew?
He doesn't sleep either.
Awesome. It's the best.
Okay, so mitral stenosis is going to be different than regurgitation because it means you're going to hear noise when the valve is supposed to be open, but there's friction as the blood goes through that valve. Okay, so when a valve is stenotic, you're going to hear abnormal sounds when it's supposed to be open because of friction. When it's incompetent and you have regurgitation, you're going to hear that when the valve is supposed to be closed, but it couldn't quite close all the way. Okay, so stenotic is kind of, think of it as an opening issue. Regurgitation or an incompetent valve, think of it as a closing issue. Okay, anyone know what patent ductus arteriosus is?
There's between the atrium and the utero, it's open.
Not necessarily just in utero, but yeah. So basically,
Fails to close.
you have a wall between the right side of the heart and left side of the heart. Sometimes there ends up with holes in the wall that usually are congenital. You're born with them. Hopefully caught right away, but there's some cases where they're not. And so patent ductus arteriosus is when there's basically a hole between the two atria.
Not good.
You said stenosis was an open?
Opening issue. Regurgitation is a closing issue. Okay, so if there's a hole in the heart, you have blood leaking back and forth between the atria all the time. So what sort of signs and symptoms? So let's say you have a child, this was not caught, and now they're 3 years old, and they're running around a whole bunch. So what sort of signs and symptoms are they going to have?
Cyanosis.
They may have some cyanosis. What else?
Fatigue easily.
They're going to fatigue quicker. And
Tired.
why is this happening?
They have poor preload, so poor cardiac output.
No, their preload might be fine. Their cardiac output might be fine. But it's between the two atria. You have mixing of oxygenated and deoxygenated blood. So every time the left ventricle contracts, it's not purely oxygenated blood. And so when O2 demand of the muscles goes up, like during activity, that blood, plenty of blood is getting out to the muscles, but that blood isn't fully oxygenated. And that's why the patient's going to fatigue, and then eventually you can end up with cyanosis. Okay, what system exerts the main influence on the rate and strength of heart circulation? What body system exerts the main influence on heart rate and strength of heart contraction? So there is a cardiac control center in the brain stem, but what system is that?
Central?
No. Autonomic. Fight or flight. What is a heart murmur?
Sweet nothings.
No. Heart murmur. Anyone?
Is it extra beat? Or
Yeah, it can be caused by a few different things, but it can be an extra beat sometimes.
a flutter? Like a less, more?
Flutter would be a specific type, yeah. Okay, what's the medical term for a resting heart at more than 100 beats per minute? You should all know that.
Tachycardia.
Tachycardia.
Cocaine time.
Okay. Cardiovascular disease. It's the most common cause of death in first world countries. These are the main ones. So remember, stroke is actually cardiovascular disease resulting in neurologic deficit. Okay, so here's some diseases that you have to know. Okay, so if there's an issue with the endocardium,
It's not
what
good.
part of the heart is that?
Inside.
Inside. So you can have what's called infectious endocarditis, where a bacteria infects the endocardium. This is common actually after dental procedures. Anyone know why? How would a dental procedure lead to a heart infection? Bacteria is knocked loose. You're usually bleeding at the same time. Bacteria ends up in your circulatory system. I unfortunately had a friend's father in high school. And actually, if you don't treat strep throat, it infects your heart as well. If the myocardium ends up having an issue, that could be a myopathy. Or you could, remember we talked about excessive hypertrophy of the left ventricle, which eventually is going to make the cavity smaller and the heart overworked. And myocardial infarction is technically affecting the myocardium because it's going, the lack of coronary circulation will lead to muscle cell tissue death. And if it's extensive enough, it will kill you. If there's an infection or inflammation of the pericardium, that's called pericarditis, similar to pleurisy of the lungs. It's the lining that becomes inflamed. So if the heart lining becomes inflamed, it's going to restrict the ability of the heart to contract and relax, really more relax. Okay, and then we have a few other different heart diseases that are named actually for the cause instead of the anatomy where they're infected. So congenital heart disease would be something you're born with, like the patent ductus arteriosus. Rheumatic heart disease is when the rheumatic virus ends up in your heart. Coronary artery disease is where the coronary arteries become occluded. Lots of different infections, and then eventually heart failure, which just happens to, I forget his name,
Leonard Ewan?
no, the other one who died over the weekend, the Nick Clare, basketball player. Yeah, Anthony Mason. He just died of heart failure. I really want to know why, because he was only 43.
I know.
48.
We were talking about
48.
that.
You got
Still.
the facts, Dr. Will.
This guy.
Yeah, it was congestive heart
Back to
failure,
back
but
to
48, that's
back.
crazy.
Look.
How tall is he?
I know, that's what I was thinking,
big
like,
guy.
he was only like,
Warmer.
He's like a 7-foot tall.
no, he was like 6,
6'9".
yeah.
I feel like it was. It had to be something hereditary.
Yeah, I don't know, everyone
We were talking about what's his name from LMU that passed away, Hank Gathers. Remember he died
Yeah,
Is
early
that
too,
warm?
Yeah, usually when young athletes die.
right?
But 48, I don't know. He did like drugs or
I don't think
Whoa,
so.
whoa, whoa. Yeah, Hank Gathers did some drugs.
yeah, it takes you out pretty quick.
He was a pretty big guy.
Yeah, but it's not like
He's not a.
all
He's not an
huge
Amazon.
people. He was, again, he wasn't in the 7-foot range.
The bigger you are, the harder you fall.
Okay, congenital heart disease. Here's a few of them. Write all these down. And we will go through some of these. But these would all occur in utero, but again, they're not necessarily diagnosed in utero, and they're not necessarily caught right away.
One moment.
Okay, so these three all have to do with holes in the heart wall, in the center, and the septum. And we'll go over those.
Sharon, where's your name?
No, interrupt us.
Please.
Hey, gorgeous.
Thank you. Yes, good. Thank you.
I love fruit.
I have here applications for junior blind, Special Olympics. So I'm going to pass it out. If you want to participate, please get the application.
The date is Saturday, May 2nd. Exactly 2 months.
My heroes
Now, I need volunteers for the CI training class for a luncheon. I'm going to remind you that the clinical instructors are volunteers. They are not reimbursed for being your mentors. They are giving back and helping educate you and helping groom you in your skills. So I very much in need of help.
What time on Saturday do you need help?
Thank you.
I hate to tell you.
I would say 11 o'clock, 11 to 1.
11 to 1, this Saturday and next Saturday.
So I have Rebecca for the 14th, correct? And everybody else is all right. Check your schedules again.
Add it to your portfolio and your resume. Potentially meet your CI.
All right, yeah, you might. I mean, yes, you might. Because some of our clinical partners will be sending participants. And I'm happy to say that we're having four PTA graduates as well. So I look forward to your attendance. Okay, so we now need it for the 7th, which is this Saturday. Check your schedule. Okay, thank you. Anybody else in need of one of these? Y'all have it?
You were struggling.
No, let it.
Turn it off.
Okay, thank you.
I didn't realize you had. No, it's fine.
Okay, atrial septal defect is very similar to the patent ductus arteriosus. We have a hole between the walls of the atria, and so you have the mixing of oxygenated and deoxygenated blood. I'm not going to try to say that, but this is where the aorta has an abnormality in it, and it's very narrowed, which is going to limit the potential of what? Let's talk through what would happen. We have a narrowed aorta right here, what's going to happen?
Oxygenated blood to the body.
Yeah, it's going to limit the amount of blood the left ventricle can eject, therefore limiting the amount of blood that can reach the rest of the body, and may even cause backflow into the left ventricle. Or, really more realistically, the left ventricle would not be able to completely empty.
You have hypertrophy also?
And eventually you would have hypertrophy because it's working against this resistance. Yeah, if it wasn't caught, it would eventually kill you, yes.
Could it potentially cause hypertension in all the vessels before the coarctation, before that narrows?
Well, yeah, it's kind of imitating what hypertension would look like, actually.
So you could have a coronary hypertension in the coronary artery specifically, or?
No, because it's just the aorta. The coronary artery circulation comes from somewhere else.
So it came right off the aorta, it would be the heart.
Yeah, but it would come off before. Okay, so I always forget this one. The arteriosis of patent ductic is actually, you have a mixing of the blood from the pulmonary artery and the aorta. So the hole is actually in the aorta, and it connects the aorta to the pulmonary artery. So patent ductus arteriosus is a connection between the aorta and the pulmonary artery.
Not between the ventricles.
No, that would be that's the atrial septal defect and the ventricle septal defect.
So you need to have mixing of oxygenated and
Again,
deoxygenated
it's still an
blood.
issue of mixing oxygenated and deoxygenated blood.
But because the left ventricle is stronger, there really isn't any deoxygenated going into the aorta, right? It's mostly,
No, it is. It's mixing.
oh.
It's gonna mix.
Looks like the arrows are bigger and more robust, going from the aorta to the pulmonary artery.
True, it's still gonna end up in the same result.
Okay.
Okay, ventricular septal defect is a hole between the walls of the ventricles, so this can be even a little bit more serious than the atrial septal defect. Same issue of the mixing of oxygenated and deoxygenated blood. Okay, this is when we have three things happening at the same time. Tetra is 3. That would be fellow. They toss it.
Fellow.
Tetris 4.
Okay, so we have pulmonary stenosis. So stenosis of the pulmonary valve. We have a ventricular septal defect. And then resulting of right ventricular hypertrophy, because the right ventricle has to work really hard against the pulmonary stenosis. Okay, so the tetralogy is pulmonary stenosis, right ventricular hypertrophy, and a ventricular septal defect.
Probably don't live long with that, huh?
No, and again, a lot of these congenital ones we hope are caught early and then repaired, but there's always people who slip through the cracks. And slip into death, yes. Okay, so rheumatic heart disease is what I was talking about when the strep virus infects the heart. I feel like, what was that game where you could get this? Oregon Trail. And people died this.
Oh, yeah.
Yes.
You killed a buffalo, you can carry 4 pounds of meat.
Yeah.
You used to have to pay like $200 for
Okay, so again,
medicine.
strep bacteria ends up in the heart,
Are you done with this?
and actually it becomes a systemic disorder. But the real issue in the heart is that the heart valves become inflamed. Which can cause pulmonary congestion, aka pulmonary edema.